Good morning, everyone. We had to wait for Jay to get ready this morning. Jay's in a good mood today, but just on a little bit of a delay. So anyway, thank you, Jay, for being here this morning to help interpret for those who are hearing impaired. And good morning to everyone else. As always, we're going to start with the numbers. I spoke with the Commissioner of Health, Greg Kesterman, this morning. So the counts today are 615 individuals in Hamilton County have positively tested for COVID-19. 147 of those individuals are hospitalized, and we have 29 deaths. The Delta, since last time we spoke, remember that was 2 days ago, so since Wednesday, 39 more cases testing positive, 13 more hospitalized, and 5 more deaths. The number of recovered, and remember this is only a Hamilton County number, this does not include the city of Cincinnati, Norwood, or Springdale. That number is 125. So we have seen some troubling national trends related to the impact of COVID-19 on the African American community. And so today our topic is that important topic: the impact of COVID-19 on the African American community in Hamilton County. We are, as you know, still gathering data in Hamilton County related to demographics, related to race. And so we have some of that information in, and that is reflected on the Hamilton County website, but we don't have all of it in. So the epidemiologist, while they are tracing individuals who have tested positive and make sure that people are notified that they may also have been infected, the epidemiologists are also tracking this demographic information. So we do have a little bit of a delay because of the volume of work at Public Health, but I've asked the Health Commissioner about this, and I feel pretty confident we're going to have some good numbers by next week. We've got a nice start, but we need more information to allow us to understand better these impacts. So Renee Mahaffey-Harris, who is the CEO of the Center for Closing the Health Gap, is here to discuss this issue with us this morning and what her organization is doing about it. We are also pleased to have Commissioner Victoria Parks here to discuss a new initiative from her office aimed at reaching young African Americans during COVID-19. Her Chief of Staff, Sonia Taylor, is also here joining us this morning. So a couple of things before we get started. As some of you know, we had another walkthrough of the Duke Convention Center yesterday. Remember, Duke is being set up for a step-down facility because we expect we might have excess need in our hospitals as we see the surge come to Hamilton County. And so a couple weeks ago, we went through Duke with the National Guard, the Army Corps of Engineers, the city, the county, EMA, public health, the hospitals, all there collaboratively saying, all right, what are we going to need in this community to respond if we see that surge? And at that time, we were talking about 500 beds plus. Right now, as of yesterday, we are set up for 150. That is the good news. That is a result of what everybody in this community has done to tamp down the spread, flatten the curve of COVID-19 in Hamilton County. So I just want to say thank you, thank you, thank you to all of you who are staying home, washing your hands, distancing yourselves. It's working, and so our need for that capacity has greatly diminished. We frankly hope we don't have to use any of those beds. But the fact of the matter is we might need some. And so I think the message to the community is we're ready. I have a great deal of comfort knowing that we're ready. And so as things progress and things shift in Hamilton County, just know that we have those beds set up. Thank you to the mayor for his initiative on this. And so we're ready to go. A couple other things. Don't forget to fill out the census. We need you to fill out the census. We need everyone to be counted. Remember, these dollars that we receive from the federal government, we're in the middle of that right now, playing out through COVID-19 are related to the services that we are able to provide in Hamilton County, and it also represents economic development dollars. So please, if we have an undercount, we will not see our fair share in Hamilton County and in the city of Cincinnati. So another collaborative effort with the city and the county. If you haven't, I did it. 6 minutes. It took me 6 minutes to fill that out. Now, I will tell you this. If you have a bunch of kids, it's going to take a little bit longer. Alex Linzer, my chief of staff, it took him a little longer because he's got 7 kids. I'm just saying. But it took me 6 minutes. So I just want to let everybody know it's not a huge time commitment. So go to the census at 2020census.gov. Please fill out the census. It doesn't take but a minute. Oh, and after you do it, do hashtag Greater Cincy with a Y counts. Hashtag Greater Cincinnati counts to encourage your friends and neighbors to do the same. The other thing that's going on right now that's, I hope not, but maybe been sidelined a little bit, is voting. We are in the middle of an election cycle. And so it's been very strange. I will tell you, as someone that's on the ballot, it's been very strange this year because we're going to have an all mail-in election this year. But the dates are important, and we're starting to run out of time. And so I just want to remind everybody that you have to, it's a 2-step process, as Commissioner Parks has noted. You have to contact the Board of Elections to get an application. You have to fill out the application, send it to the Board of Elections to get your ballot. 2-step process. That takes some time. And so please, make sure you are contacting the Board of Elections to get the application in order to get the ballot. Also, there are applications at some of the Kroger stores throughout the county, and so if you are in a Kroger, please pick up that application there. I think many of us are very worried that people have just, you're just not thinking of it. And so please remember to vote. I'm going to give you a couple of dates because I was struck by these dates myself and how quickly this is approaching. So technically, the election day is April 28th. So you have to get your ballot in. Hold on, I'm sorry, Jay. So you must submit an absentee application to receive a ballot in the mail. The board can accept applications until noon on April 25th. That's next Saturday. And so then you have to, once you get your ballot, submit the ballot, either mail it into the Board of Elections by April 27th, which is the following Monday, or drop it off to the Board of Elections by 7:30 in the evening on Election Day, April 28th. Please visit the Board of Elections website for details there. We are very anxious that people aren't remembering to vote, so please, spread the word. It's census time, and it's time to vote. So with that, we're going to move on to our topic for today. It's my pleasure to introduce Victoria Parks, County Commissioner. Victoria is leading the charge in trying to create messaging, important messaging and communications to the entire community in Hamilton County, particularly youth. And so I'm going to turn it over to Commissioner Parks.
Good morning. Boy, I've missed being here. I certainly hope that everybody is well and taking care of each other. My chief of staff, Sonia Taylor, was in her weekly meeting with chiefs from the other 2 commissioners' office, where the discussion turned to how COVID-19 is affecting the African American community. She suggested getting some athletes together to get a message out to our youth about the seriousness of COVID-19. So now Sonia Taylor, my chief of staff, will now come and show the result of her work.
Good morning. First, I want to thank the commissioners for the opportunity to work on this project. Excuse me, after finding out that COVID-19 disproportionately affected the African American community, I wanted to do something to get a message out to our youth so that they understood the seriousness of COVID-19. So I reached out to some athletes, asked them to participate in putting together this video that we're going to present to you now.
Hello, Cincinnati. Delano DeShields here, first base coach for your Reds. We're facing one of our toughest opponents yet, and it's one that we can't even see. It's called coronavirus, and yes, it's real. Did you know coronavirus disproportionately affects the African American community? We need you to help flatten the curve. I know you think this doesn't affect you. However, it does.
Hey guys, it's Hannah. Do you know how you can be an MVP of the defense of coronavirus? Make sure you're washing your hands at a bare minimum of 20 seconds, and make sure you're wiping down all your electronics and everything that you use every day. Stay safe.
I'm already great with Xavier Women's Basketball. My teammates and I have been practicing social distancing. Please lay low and stay home as much as possible. When you have to go out, keep 6 feet between you and others. Do not pull up at your friend's house. Use social media to stay in touch instead.
I'm Trayvon Scott, former UC basketball player. Make sure you stay away from crowds and gatherings. Make sure you do everything you can to protect your parents and grandparents from the coronavirus. We are going to get through this together. We are Cincinnati Strong.
Okay, so thank you. I hope that you all will take that to heart. Young people in Hamilton County have violated the stay-at-home order. You likely saw it on the news. My concern is the perception being drawn by certain leaders about our kids. We know that young kids think that they are invulnerable, invincible. I certainly did as a young woman. It is imperative that we relay the severity of COVID-19 with language that young people can hear, and for leaders to express themselves professionally and treat young folks humanely. Our only job as elected officials and leaders is to preserve the world we live in and to utilize our platforms to create a better world for the future. That's young people. That's our youth. My message today to the young citizens of Hamilton County is this. We need you to know that we value you, and more than anything, we need you to survive. This is a frightening and surreal time. We keep hearing that it is unprecedented, uncharted territory. Well, I dare to disagree, because it depends upon who you are. When America catches a cold, African Americans catch the flu. Now that America has coronavirus, African Americans are dying at alarming rates. The current demographic statistics are: in Chicago, Black folks make up 30% of the population, but account for 72% of all deaths. In Detroit, the stats are African Americans comprise 13% of the population, however, 30% of infections and 40% of deaths. In Louisiana, 7 out of 10 deaths are Black folks. And please do not forget about the effects of Hurricane Katrina. In our state of Ohio, 19% of coronaviruses affect African Americans, but we're only 13% of the population. Let me be crystal clear. People of color are not biologically or genetically predisposed to get COVID-19. America has a historical social justice deficit that is exacerbated when wealth, health, opportunity, criminal justice, and equality is called upon to stand in the gap when crises arise. If we look back to as recently as the 2008 recession, the unemployment rate, for example, peaked at 9% in 2009 for Americans, for all Americans. For African Americans, it exceeded 16%, compared with a little under 9% for white families. African American family incomes also suffered more than white families. The average black household earned 61% of what a white family earned in 2010. Now, I may look like your grandmother. She is not, and neither am I, that old. My parents were born in the South during Jim Crow, which were a collection of state and local statutes that legalized racial segregation. The laws existed for about 100 years, from the post-Civil War era until 1968, and were meant to marginalize African Americans by denying them the right to vote, hold jobs, get an education, or other opportunities. Those who attempted to defy Jim Crow laws often faced arrests, fines, jail sentences, violence, and death. Your grandmother may have been born before Jim Crow was outlawed. I was. I started my education in a segregated school. During the Great Depression of the 1930s, African Americans were the last hired and the first fired. The reason I bring these times in history up is to remind you that we, as a people, have always had obstacles to surmount, and we do. I also want to remind you that our foremothers and forefathers fought to survive. They overcame horrible living, working, and health conditions so that you and I could live. They fought with a dream in their heart for a better day. They survived so that you and I would survive. I am reminding you to hold your head up and be proud of the conquering blood that runs through your veins, that God Almighty covered with beautiful black skin. We are not new to this struggle. We show the world how to overcome struggle. I need young citizens of color who live in Hamilton County to survive. The problem is, leaders never ask young citizens what they want, what they need. As we navigate COVID-19 together, I need your help. Will you tell me how you feel? How do you see the future? What do you need to survive? My office has established hashtag 513survive, a medium for you to utilize to express yourself. So I invite young Hamilton County citizens of color to let me know what you are going through during this shelter in place caused by the coronavirus. I need you to survive. If you draw, paint, dance, write poetry, sing, rap, or just want to talk, however you express yourself, you are invited to use your cell phone to video it and send it to a designated email address created by Hamilton County. I will provide the email at the end of the presentation, so get your pen and paper. My staff will view your videos. Our videographers will cut and paste them to create a public service announcement that will be featured on our website and an array of outlets in order to educate our community about the challenges you face. So, we're lucky enough that we have had 5 young people do exactly this. So here is an example of what a video looks like.
I did my first research project this year, and I'm unable to present it because of the research forum getting canceled. And I got accepted to an internship, which was also canceled.
The workload they're giving us online is different from what is at school, so that's one thing that's different. Flexibility is nice, but sometimes you find yourself having to stay up or wake up early to do your stuff, so that's one thing that makes it challenging.
Being a senior, especially, we have a lot of things that are being stripped away from us, like prom and graduation, senior prank days, and stuff that I look forward to doing for 12 years now is just gone. And it's pretty devastating, and a lot of memories that I probably will never get to make is just gone.
Yeah, just the whole entire transition from in-class work to all online classes is just really depressing in a way. I just know like a lot of other college students feel really unmotivated to do their work because it's online, and it's just been a really hard transition.
School-wise, I wasn't expecting to have to go online, so it's really hard because I don't learn that way, which is making me feel unmotivated and making me feel a little bit depressed because I'm stuck here and I really don't have any help with classes. They say we have help, but it's not really the same when you're having to talk to them over the phone. And all of mine are arts classes, so I need to be shown what to do, and it's just not really possible.
Thank you, Commissioner Parks, for listening to our voices.
That the young people in our county will participate in this activity. And I am so excited to announce that those who do participate in the video project are invited to participate in our hashtag survive, hashtag 513 survive council, where my office will provide you the ability to meet virtually, communicate with one another, to decide what issues are your biggest obstacles and how leaders in Hamilton County can help you overcome them. The council will be organized and run by you and your peers. Hannah Willingham, who is your 20-year-old peer and liaison to my office, is your chairperson. She will work with you, communicate your concerns, questions, and progress to me, and be the conduit through which I communicate to you. I look forward to meeting you once you all decide upon a date for your first meeting. So I encourage you to grab your power, decide what your priorities are, and make them known through this council. Learn how powerful you are through this process. My hope is that by the end of May, the council will formulate a list of recommendations to submit to Hamilton County Commissioner Denise Dreihaus, Commissioner Stephanie Dumas, Sumero Dumas, and myself. I admit that it is a short deadline, but I know that your concerns do not require a long time to think about. Tell me what they are. Now, here are the details. Videos are due in 2 weeks. That's May 1st, 2020, by 5 p.m. Submit them to the email 513survive@hamilton-co.org. So do we have that up on the screen, guys? Great. The video should be up to 2 minutes in length. And, in Hamilton County, requires a completed waiver. And if you are under 18, parental consent. Our office will provide the form. So that's it. Thank you.
Thank you, Commissioner Parks. And I'm going to introduce Renee Mavey-Harris is with us from the Center for Closing the Health Gap. Renee, please come over. Thank you.
Well, good morning, and thank you for inviting me to talk with you about a lot of the information that Commissioner Parks has already shared, and I thank Commissioner Dreihaus for inviting me here, as well as Commissioner Dumas. Health disparities are in the news the past few weeks, and the issue of health disparities have persisted for over 35 years. Secretary Heckler, under Health and Human Services, launched a study that was extensive for over 18 months. And that study then showed us that regardless of your educational or socioeconomic status, race is the factor that contributes to our health outcome. That study showed that Black people have higher incidence of most major diseases as well as death in comparison to the white community. So that was data from 35 years ago. In 2016, the federal government authorized a study of the Heckler Report. That report showed us that there has been no change in health disparities in America. So we ask ourselves, why did the news start telling us that the rates of death and the incidence of COVID-19 were disproportionately impacting the Black community? I think that data from 35 years ago and the status of where we are in not moving the needle in health disparities is why. Dr. Fauci even said in an interview that the issue of health disparities has had a light shown on it. The solution isn't going to happen today, isn't going to happen tomorrow. It has been an issue that has been pervasive in our nation for decades. So it is going to take collaborative efforts from us all. At this time, I don't think it's about pointing fingers at anyone. I think when I think about where we are in our country, in our city, in our county, related to this very serious issue and pandemic that's facing us all in this world, the most important thing that we can do is come together. We are not alone. We hear from residents who are alone and just need to hear voices. And I think the reality is that we are in this together. And so one of the things I'm really proud of when asked, like, what is the Health Gap doing? We are continuing to connect to all of the individuals that we serve, but more importantly, we are reaching out and working together with organizations in launching COVID-19 communityresources.com. That's COVID-19 communityresources.com. It was a site that was launched on March 23rd by the African American Chamber of Commerce President Eric Kearney, by the president of the Urban League, Eddie Cohen, by the president of the NAACP, Robert Richardson and Joe Mallory, by the Health Gap, as well as leadership from Council Member J. Michelle Lemon Kearney. We have been joined by over 15 new organizations, all joining together to share information through this site. There are 7 categories in this site, and one of our most important partners are the medical community. The Cincinnati Medical Association, led by Dr. Roosevelt Walker, have launched in the site an Ask the Doctor feature. So if you have questions, if you're not sure, go to COVID-19 communityresources.com and click on Ask the Doctor. And there are doctors manning that site 24 hours a day to answer your questions and provide information. I've been on calls locally, I've been on calls nationally, and webinars. And one of the big questions coming out of the Black community, or concerns or issues, as Commissioner Parks has shared, is how we communicate the messages. Locally, we have Public Medical launching 6 feet apart and mask up. We have initiatives like Commissioner Parks. We have voices from CEAI, from Pastor Damon Lynch, many other leaders. We are not a monolithic community. Therefore, there are so many different voices that are together working towards elevating and activating our individual knowledge and capacity to protect ourselves and our families in this time that we face in our world with the pandemic of the COVID-19 coronavirus. I am really honored that the Health Gap has been in existence over 15 years, addressing the needs of health disparities, and addressing health disparities and elevating the knowledge to individuals, because really at the end of the day, it is about our own individual agency and activation. So it is more important than ever that we, the Health Gap, and many organizations, and all organizations serving the Black community, serving individuals who are marginalized in our region, to share information, make it easy to get information, activate information coming from your family, from your friends. The more we can share information and get rid of the myths that are on social media and other places, the more likely we are going to be able to save lives. And I know that together we will and we can turn the tide and make sure that lives are saved in the Black community, that lives are saved in all of our communities. Coronavirus doesn't have a face or name to it. And yes, we are finding that there's a disproportionate impact to the Black community because of housing density, because of underlying risk factors, because of complications that do arise when you have compounded diseases and you then are infected with the coronavirus. You can understand medically how those complications can occur, as was shared with me by one of our hospital system CEOs. But what we do know is people are recovering. I think it's most important for us to listen to the cry from all of our medical experts, which are to stay 6 feet apart and mask up and exercise social distancing and make sure that we are sharing good information with all of our fellow citizens in our community. But in particular, for me, the Black community, we must come together across all organizations, faith-based organizations, all of us coming together as one to make sure that we give the information to our communities, to seniors, to children, to families, so that we can save our lives and make sure that we have all that we need, from food and shelter to emergency resources. Again, the COVID-19 communityresources.com site was created in particular to have a trusted place for information to be received, as well as information to be shared. So you can upload information. I look forward to uploading the 513 Survive, uploading all the information that we learn about through various organizations, so that we can not only share information, but you have the opportunity to provide information and upload it on the site. I keep emphasizing the site, because one of the challenges that we are hearing across our country is that in the Black community, communication has often been driven through our churches, through barbershops and beauty salons, and through word of mouth. Many of those businesses are closed. So the economic impact to the Black community is severe. And the way that we communicated has been impacted. So that means we're going to have to come up with more innovative ways so that we get information to each individual, so that we can activate our own individual agency and knowledge to protect ourselves and to protect our families and to protect our communities. I thank the commissioners for having me here today to talk about health disparities. The issue of health disparities didn't start today or yesterday. It has persisted for decades and centuries. And so together, when we come through this time, because we will get through this together, I know that God is in control and He will see us through this time. So after we get through this time and our new normal is created, because we will have a new normal, we must work together to address the issue of health disparities so that the disproportionate impact to disease outcomes and death are no longer the conversation in our news. So I thank you, and 6 feet apart, mask up. Thank you.
Thank you, Renee, for helping us illuminate what's happening in Hamilton County. So, Bridget, do we have any questions today?
We do. Our first question is from Chris Wederick with the Business Courier for you, Commissioner.
Okay. Hi, Chris.
Hey, good morning, Denise. Yesterday, the commissioners talked about are we getting an echo? Sorry. There was $142 million worth of COVID-only spending to be done from the federal money that you guys have received. I think you said briefly that there was a possibility of sharing that among local governments. How are you going to determine that and who gets what? Also, $142 million, it seems like quite a bit of gloves and masks and all of that. I mean, is there Is there enough need to spend all that money on the COVID related expenses?
So thank you for the question. We have, as you know, been trying to get some flexibility with those dollars so that we can use them for revenue replacement. In other words, the budget hole that is going to exist because of the reduction in the sales tax fees and other things that impact our revenues. However, I will tell you as of today, I'm not overly optimistic about that flexibility. And so it puts us in a position where we've got significant resources, but they're relegated to the response to COVID-19. So we're grateful for the money, but it has to be used for a very specific purpose. And so we are able to move some of those dollars out the door, and we've done that. So when you talk about PPE, the masks, the gowns, the gloves, so we have placed orders through our purchasing department to create a stockpile in Hamilton County. That stockpile, and I illuminated this, I think, 2 days ago, some of that supply is going to the hospitals, some of that's also the national stockpile, some of it's going to first responders throughout the county, it's going to nursing homes, and so it's going to JFS, and so that's how we're using it. We also have purchased some 911 equipment so that we can spread out the employees that are answering the emergency calls. We have also used some of those dollars to rehouse the homeless population. But that doesn't represent anywhere near the number that we've got. And so what we're hoping for is if we can't get the flexibility to use it for revenue replacement, can we at least use it as our 49 jurisdictions respond to the crisis in their own individual ways? Can we help them replace the dollars that they've spent for COVID-19 through the county resources? So that's what we're looking for. We don't have the language from Treasury yet, so it's been really challenging to understand whether or not we can do some of this stuff, but we sure do hope that we can. We've already reached out to the local jurisdictions to say, hey, if we're in a position to help, we want to do that, and that includes the city of Cincinnati and all 48 jurisdictions also outside the city.
Okay, thank you. And then one other question, the resolution, there was 4 priorities that you guys listed, and the 4th one was support for small and medium-sized businesses. Could you speak to, if you can spend it on that, what form could that take? Would it be grants or loans or something through HCDC?
Well, that may be and all of the above, right? So I've talked to Jill Meyer, I've talked to Pat Longo, both working in that space for small businesses. What we know is many small businesses, as was referenced earlier, are being impacted here, some more than others. And so if we can provide some relief through those dollars, we'd like to be able to do that. I'm not sure what that's going to look like. Again, we don't have all the guidance that we need from the Treasury Department at the federal level, but that is one of the focus areas for those dollars if we can use them there.
Thank you, Denise. That's all I have for right now.
Thank you. Larry Seward from WCPO has questions that can be answered by all of our panelists.
Okay.
Good morning, commissioners, as well as Renee. I'm looking at the most recent data from the Hamilton County Health Department regarding disparities, and it shows that in the 9 poorest zip codes in Hamilton County, that the COVID case rate is more than twice as high as the wealthiest zip codes. And in the most non-white populated zip codes, the case rates are 3 times higher than more whitely populated zip codes. I'm wondering what you all know about the ingredients that are causing this. What's different about Crosby, Cleves, and Beavis compared to Camp Washington, Avondale, and Bond Hill? I know, Renee, you mentioned housing density, underlying risk factors, and some compounded diseases, but can you be more specific?
So yes, besides density, it's underlying risk factors, higher percentages of people who are managing multiple comorbidities like hypertension, diabetes, and some other disease factor. And so and as well as rates of obesity. And so those disease factors create greater complication when the coronavirus presents itself. So in the communities that you describe where there's a larger Black population, the data on health disparities has shown that we have a higher incidence of most major diseases across the Black community in this country. So the question as to why we're seeing the same data in Hamilton County mirrors the same data that we're seeing across the nation that Commissioner Parks referred to. The reasons for that are systemic and structural. Race is a construct in the health and health outcomes and health delivery in our community and in our nation. And I don't know if that answers your question. Coupled with density, coupled with loss of income. So when we look at the income and income losses from a large service population, I mentioned earlier barbershops and beauty salons. So that's just an example of small business. But when you start looking at service jobs where we are potentially those service jobs in grocery stores and other custodial and other types of services, right? We're still working because we have to. When we look at the unemployment rates, as Commissioner Parks referred to, those unemployment rates in the neighborhoods you mentioned you probably look at that data as well, and those unemployment rates prior to the coronavirus were already high. And so you're multiplying the factors, therefore the impact upon populations that are already disparate makes that outcome even worse. Does that answer the question?
It does from your perspective. I'm wondering for the commissioners, were they aware of the current disparities that I mentioned in the county, and how is the county planning to approach those?
Yes, we are aware of it, and we know that it's caused by the by the disparities in our community. I would also add to what Renee talked about is I think that our culture also has something to do with the spread of coronavirus. For instance, how about this? When's the last time you have seen two white men embrace when they greet each other? We tend to live in community. There may be more family members in a house, and coupled with the disparity in income, insurance, lack of a relationship with the primary care physician. And so because of the disparity in the income, these people tend to live in the neighborhoods that they can afford. That's why. Anything else?
No, thank you.
Our next question comes from Sherry Coolidge, and it is for Commissioner Dreihaus and possibly one for Renee.
Can you hear me? So, Denise, my question for you is a follow-up from Monday's press conference, which is, have you heard back from any of the departments that have been asked to cut 20% and whether they've been able to do that?
I have, actually, and I know some of those cuts are rolling out tomorrow. What is today, Friday? Today, sorry, today and Monday. And so, they're starting to roll out now. I can speak from our floor alone. We're, as we've said, taking pay cuts ourselves. Unfortunately, we're furloughing part of our staffs and doing what we need to do to make those pay cuts amongst the departments that are really on this floor. But as you know, I've talked to many of the department heads and elected officials, and so they are rolling out those strategies. So I understand your question. We'll have better numbers for what those impacts look like probably early next week.
Okay, my follow-up question is for Ms. Harris. Good morning. So at Council on Wednesday, we saw them make very difficult decisions to cut human service spending, basically what's left for the rest of the year, and there's a lot of concern about what next year is going to look like. Can you speak, and it's not just your agency, it's many agencies they've included over the years to help the Black community. Can you tell me about the impact of what those cuts are going to look like to the services that are being offered for yourself and for these other agencies?
I think that all of the agencies are going to be impacted and impact our ability to serve the residents of the city of Cincinnati. However, as I said in my earlier comments, I think the way that we overcome the challenges that we are all facing is working together. And so the examples I've given on how we're working collectively and leveraging the resources of many other organizations, I think we're all going to have to put our heads together and figure out how do we continue to serve the populations that are most disproportionately impacted by this disease, but also most disproportionately impacted by many other underlying factors that contribute to poor quality of life. Do you want me to go further, or?
It's helpful, thank you.
Thank you. It does not appear that we have any other questions from reporters.
All right, very good. So thank you to Sonia, to Victoria, to Renee, to Jay for being with us this morning. I think it's a really important conversation to have. Delighted to see the videos and that really important outreach to young African Americans in Hamilton County. It looks very cool, Victoria, very hats off. So want to remind people that next week on Monday, we're going to hear from the Addiction Response Coalition, formerly known as the Heroin Coalition, related to the impacts of people in our community that are suffering addiction, what it looks like to still get the recovery needs covered in Hamilton County by those that are in recovery. There have been some challenges there, and so we're going to hear from Tom Sinan and Tom Fallon. There's also this interesting piece when it comes to law enforcement about supply. We have seen some dips in the numbers, but it's rather sporadic. And so I know Tom Sinan will be able to speak to the law enforcement perspective on those numbers. And then on Wednesday, we're going to bring in the health commissioner again, Greg Kesterman, to talk through some of the things, some of the questions that you all have been asking. He's the expert. We're going to get him in on Wednesday to further expound on what the questions you're asking, but also the numbers. And we'll have more demographic data by then, and hopefully a more robust conversation about what we've been talking about today. So thank you all. Have a good weekend. Be safe, and we'll see you on Monday.